In my practice, I've seen thousands of men suffering from enlarged prostates, and there's one habit that's more dangerous than all the others combined. A habit so common that 90% of my patients are doing it right now without realizing the devastating impact it's having on their prostate health. But here's what's truly alarming. Most men don't even know they have prostate problems until it's too late. By the time you're waking up 3 times a night to urinate, struggling to start your stream, or dealing with that constant feeling that your bladder isn't empty, significant damage has already been done. Today, I'm going to reveal the number 1 habit that's silently enlarging your prostate, plus 9 other dangerous daily behaviors that are accelerating prostate growth. More importantly, I'll show you exactly how to reverse this damage naturally, without medications or invasive procedures. This isn't about fear-mongering, it's about giving you the scientific truth that the medical establishment often overlooks. By the end of this video, you'll understand exactly why your prostate is enlarging and have a clear roadmap to protect your health for decades to come. Before we dive into the dangerous habits, let me explain something crucial that most doctors don't take time to discuss with their patients. Your prostate isn't just some insignificant gland, it's the cornerstone of your masculine health and vitality. Located just below your bladder and surrounding your urethra, the prostate is about the size of a walnut in healthy young men. Its primary job is producing prostatic fluid, which makes up about 30% of your seminal fluid. This fluid doesn't just help with reproduction, it contains powerful enzymes and proteins that support your overall urological health. Here's what's fascinating. Your prostate contains more zinc than any other organ in your body. This zinc is crucial for immune function, wound healing, and maintaining healthy testosterone levels. When your prostate becomes inflamed or enlarged, it can't properly utilize this zinc, creating a cascade of health problems throughout your body. The prostate also contains smooth muscle tissue that helps control urine flow. When this tissue becomes inflamed or overgrown, it creates the urinary symptoms that plague millions of older men. But here's the key point most doctors miss. Prostate enlargement isn't inevitable with aging. It's largely preventable through proper lifestyle choices. In my 20 years of practice, I've witnessed an alarming trend. Prostate problems that used to affect men in their 70s and 80s are now appearing in men in their 50s and even 40s. The statistics are staggering. By age 60, over 50% of men have some degree of prostate enlargement. By age 85, this number jumps to 90%. Prostate cancer rates have increased by 30% in the last 2 decades. Emergency room visits for acute urinary retention have doubled since 2000. But here's what the statistics don't tell you. This isn't just about aging. Our modern lifestyle has created a perfect storm of prostate-damaging habits that previous generations never faced. The processed foods, sedentary lifestyle, chronic stress, and environmental toxins of today are accelerating prostate damage at an unprecedented rate. The most troubling part? Most men don't realize they have a problem until it significantly impacts their daily life. The prostate enlarges slowly, often over decades, and the early symptoms are subtle enough that men dismiss them as normal aging. Now, let me reveal the number 1 habit that's silently enlarging your prostate. After analyzing the lifestyle patterns of over 3,000 patients, one factor stood out above all others: chronic sitting and physical inactivity. Here's why this habit is so devastating to your prostate health. When you sit for extended periods, you're creating constant pressure on your pelvic region. Your prostate sits directly in this pressure zone, and unlike other organs that can shift position, the prostate is locked in place by surrounding structures. This constant compression does several things. First, it reduces blood flow to the prostate tissue. Your prostate needs a rich blood supply to function properly and fight off inflammation. When blood flow is restricted for hours at a time, the tissue becomes oxygen-starved and more susceptible to damage. Second, prolonged sitting increases temperature in the pelvic region. The prostate functions best at a slightly lower temperature than core body temperature. When you sit for hours, especially on soft surfaces or heated seats, you're creating an environment that promotes inflammation and cellular damage. Third, sitting compresses the lymphatic drainage system around the prostate. The lymph system is your body's waste removal network. When it's compressed, toxins and inflammatory compounds build up in the prostate tissue, accelerating enlargement and dysfunction. But the damage doesn't stop there. Chronic sitting creates what I call the prostate cascade effect: weakened pelvic floor. Extended sitting weakens the muscles that support your prostate and bladder. These muscles are crucial for proper urination and prostate health. When they're weak, your bladder can't empty completely, leaving residual urine that irritates the prostate. Hormonal disruption. Sedentary behavior significantly impacts your hormone levels. Testosterone production decreases, while estrogen and inflammatory markers increase. This hormonal imbalance directly contributes to prostate enlargement. Increased insulin resistance. Prolonged sitting leads to insulin resistance, which creates chronic inflammation throughout your body, including your prostate. High insulin levels also promote the conversion of testosterone to dihydrotestosterone, DHT, the hormone most responsible for prostate growth. Spinal compression. Sitting compresses your spine, which can irritate the nerves that control prostate function. This nerve irritation can cause the prostate to contract inappropriately, leading to urinary symptoms and inflammation. Consider this. The average American man sits for over 10 hours per day. That's more than twice what our grandfathers experienced. We sit for meals, we sit for work, we sit for entertainment, and we even sit for transportation. Our bodies simply weren't designed for this much inactivity. The research is clear. Men who sit for more than 6 hours per day have a 34% higher risk of developing prostate problems compared to those who sit less than 3 hours daily. But here's the shocking part. Even men who exercise regularly but still sit for long periods show increased prostate inflammation markers. This explains why I see patients who are otherwise healthy. They eat well, don't smoke, drink moderately, yet still develop significant prostate problems. They're sitting their way to prostate disease without realizing it. While chronic sitting is the #1 threat to your prostate, 9 other common habits are accelerating the damage. Most seniors reduce their water intake to avoid frequent bathroom trips, but this backfires spectacularly. When you're dehydrated, your urine becomes concentrated and acidic, irritating the bladder and prostate. This chronic irritation leads to inflammation and enlargement over time. Dehydration also thickens your blood, reducing circulation to the prostate. Additionally, concentrated urine is more likely to cause urinary tract infections, which can spread to the prostate and cause serious complications. The solution isn't just drinking more water, it's drinking water strategically. Sip small amounts throughout the day rather than gulping large quantities. This maintains hydration without overwhelming your bladder. Chronic stress is a prostate killer. When you're constantly stressed, your body produces elevated levels of cortisol and other inflammatory hormones. These hormones directly contribute to prostate inflammation and enlargement. Stress also causes muscle tension in the pelvic floor, restricting blood flow and nerve function to the prostate. Many of my patients report that their prostate symptoms worsen during stressful periods. This isn't coincidental. Modern life creates unique stressors that previous generations didn't face: financial uncertainty, information overload, social isolation, and health anxiety. These chronic low-grade stressors are particularly damaging because they never allow your body to return to a relaxed state. The typical Western diet is a recipe for prostate inflammation. High in processed foods, refined sugars, unhealthy fats, and low in nutrients, this diet promotes the exact conditions that cause prostate enlargement. Processed foods contain advanced glycation end products, ages, and other inflammatory compounds that directly damage prostate tissue. The high sodium content increases fluid retention and puts additional pressure on the urinary system. Perhaps most damaging is the omega-6 to omega-3 fatty acid ratio in the modern diet. The ideal ratio is about 4 to 1, but the average American consumes a ratio of 16 to 1 or higher. This massive imbalance promotes inflammation throughout the body, including the prostate. Poor sleep quality and insufficient sleep duration significantly impact prostate health through multiple mechanisms. During deep sleep, your body produces growth hormones and other repair compounds that help maintain prostate tissue. Sleep deprivation also increases inflammatory markers and disrupts hormone production. Men who regularly get less than 6 hours of sleep show significantly higher levels of prostate-specific antigen, PSA, a marker of prostate inflammation. The relationship between sleep and prostate health creates a vicious cycle. Prostate problems cause frequent nighttime urination, which disrupts sleep, which worsens prostate health, which increases nighttime urination. While moderate alcohol consumption may have some health benefits, excessive drinking is devastating to prostate health. Alcohol is a diuretic that dehydrates the body and irritates the bladder and prostate. Chronic alcohol consumption also disrupts hormone production, particularly testosterone. It increases estrogen levels while decreasing testosterone, creating the hormonal environment that promotes prostate enlargement. Additionally, alcohol impairs the immune system's ability to fight inflammation and infection in the prostate. Many of my patients notice immediate improvement in urinary symptoms when they reduce alcohol consumption. Modern life exposes us to thousands of chemicals that previous generations never encountered. Many of these chemicals are endocrine disruptors that interfere with hormone function and promote prostate problems. Bisphenol A, BPA, from plastic containers, phthalate from personal care products, pesticide residues on foods, and air pollution all contribute to prostate inflammation. These toxins accumulate in fatty tissues, including the prostate, where they cause ongoing damage. The prostate is particularly vulnerable to environmental toxins because of its high lipid content and relatively slow cellular turnover. Toxins that enter the prostate tend to stay there for extended periods, causing chronic inflammation. Several common medications can worsen prostate problems, yet many doctors don't discuss these side effects with patients. Antihistamines, decongestants, antidepressants, and diuretics can all affect prostate function. Over-the-counter cold and allergy medications are particularly problematic because they contain alpha-adrenergic agonists that can cause the prostate to contract, worsening urinary symptoms. Even seemingly unrelated medications like calcium channel blockers for blood pressure can affect prostate function by altering smooth muscle tone in the urinary tract. Vitamin D deficiency is epidemic among seniors, and this deficiency directly contributes to prostate problems. Vitamin D has powerful anti-inflammatory properties and helps regulate cell growth in the prostate. Men with severe vitamin D deficiency show significantly higher rates of prostate enlargement and more aggressive prostate cancers. The prostate tissue contains vitamin D receptors, indicating that this nutrient plays a crucial role in prostate health. Most seniors don't get adequate sun exposure, and dietary sources of vitamin D are limited. This creates a widespread deficiency that contributes to prostate problems on a population level. This might seem unrelated to prostate health, but social isolation has profound effects on physical health, including prostate function. Loneliness increases inflammatory markers throughout the body and elevates stress hormones. Socially isolated men are more likely to engage in other harmful behaviors like poor diet, excessive alcohol consumption, and physical inactivity. They're also less likely to seek medical care when problems arise. The psychological stress of loneliness directly impacts immune function, making the body less able to fight prostate inflammation and infection. To understand how to protect your prostate, you need to understand the mechanisms behind enlargement. Benign prostatic hyperplasia, BPH, the medical term for non-cancerous prostate enlargement, occurs through several pathways. As men age, testosterone levels gradually decline while estrogen levels remain stable or even increase. This changing ratio creates an environment that promotes prostate growth. Additionally, the enzyme 5-alpha reductase converts testosterone to dihydrotestosterone, DHT, which is 5 times more potent and directly stimulates prostate growth. Chronic inflammation is now recognized as a primary driver of prostate enlargement. Inflammatory cells infiltrate prostate tissue, releasing cytokines and growth factors that stimulate cell proliferation. This inflammation can result from infections, autoimmune reactions, or environmental toxins. The prostate tissue contains both glandular cells that produce fluid and smooth muscle cells that help with ejaculation and urination. In BPH, both cell types can proliferate abnormally. The balance between cell growth and cell death becomes disrupted, leading to net tissue growth. Changes in blood flow to and from the prostate contribute to enlargement. Poor circulation delivers fewer nutrients and removes fewer waste products, creating an environment that promotes inflammation and abnormal growth. Now that you understand the problem, Let me give you the solution. Reversing prostate enlargement naturally requires a comprehensive approach that addresses all the contributing factors. The antidote to the sitting epidemic is strategic movement. Here's what works. Micro breaks. Every 30 minutes, stand up and move for at least 2 minutes. This breaks the cycle of pelvic compression and maintains blood flow to the prostate. Pelvic floor exercises. Kegel exercises aren't just for women. Strengthening your pelvic floor muscles improves prostate support and helps with urinary control. Contract your pelvic muscles as if stopping urination, hold for 5 seconds, then relax. Repeat 10-15 times, 3 times daily. Walking program. Aim for at least 30 minutes of walking daily, preferably broken into 2 15-minute sessions. Walking improves circulation, reduces inflammation, and helps maintain healthy hormone levels. Resistance training. Light resistance training 2-3 times per week helps maintain testosterone levels and reduces inflammation. Focus on compound movements that engage multiple muscle groups. Proper hydration requires more than just drinking water. Timing. Drink most of your fluids earlier in the day to minimize nighttime urination. Stop drinking fluids 2-3 hours before bedtime. Quality. Choose filtered water to minimize exposure to chlorine and other chemicals that can irritate the urinary tract. Quantity. Aim for clear to light yellow urine as your hydration guide rather than forcing a specific amount of water. Electrolyte balance. Include natural electrolytes from sources like coconut water or a pinch of sea salt in your water to improve cellular hydration. Your diet is either fighting inflammation or feeding it. Here's how to make it work for you. Omega-3 fatty acids. Include fatty fish like salmon, sardines, and mackerel at least twice weekly. These provide EPA and DHA, powerful anti-inflammatory compounds that directly benefit prostate health. Lycopene-rich foods. Tomatoes, watermelon, pink grapefruit, and guava contain lycopene, a carotenoid that concentrates in prostate tissue and protects against damage. Cruciferous vegetables. Broccoli, cauliflower, Brussels sprouts, and cabbage contain sulforaphane and other compounds that help the body eliminate harmful hormones and toxins. Green tea. The polyphenols in green tea, particularly EGCG, have powerful anti-inflammatory and anti-cancer properties. Drink 2-3 cups daily between meals. Zinc-rich foods. Pumpkin seeds, oysters, beef, and hemp seeds provide zinc, which is crucial for prostate health and immune function. Reducing chronic stress is essential for prostate health. Deep breathing. Practice diaphragmatic breathing for 10 minutes twice daily. This activates the parasympathetic nervous system and reduces inflammatory stress hormones. Meditation. Even 10 minutes of daily meditation can significantly reduce inflammation markers and improve prostate symptoms. Progressive muscle relaxation. This technique helps release physical tension, particularly in the pelvic region where it can affect prostate function. Social connection. Maintain regular contact with friends and family. Social support significantly reduces stress hormones and improves overall health outcomes. Quality sleep is when your prostate heals and repairs. Sleep hygiene. Keep your bedroom cool, 65-68 degrees Fahrenheit, dark, and quiet. Remove electronic devices at least 1 hour before bedtime. Consistent schedule. Go to bed and wake up at the same times daily, even on weekends. This supports your natural circadian rhythms. Evening routine. Develop a relaxing pre-sleep routine that signals your body it's time to rest. This might include gentle stretching, reading, or meditation. Address sleep disorders. If you snore or have sleep apnea, seek treatment. These conditions worsen prostate problems through multiple mechanisms. While a healthy diet should be your foundation, certain supplements can provide additional support. Saw palmetto. This herb has been extensively studied for prostate health. Look for standardized extracts containing 85-95% fatty acids and sterols. Typical dosage is 160 mg twice daily. Beta-sitosterol. This plant sterol can help improve urinary flow and reduce prostate inflammation. Effective dosage is typically 60,130 mg daily. Pygeum. An African tree bark extract that has anti-inflammatory properties and may help reduce prostate size. Standard dosage is 100,200 mg daily. Vitamin D3. Most men need 2,000–4,000 U daily to maintain optimal blood levels. Have your levels tested and adjust accordingly. Omega-3 supplements. If you don't eat fish regularly, consider a high-quality fish oil supplement providing 1,000–2,000 mg of combined EPA and DHA daily. Beyond the basics, several advanced strategies can accelerate your prostate healing. Alternating heat and cold therapy can improve circulation and reduce inflammation in the pelvic region. Warm sitz baths. Sit in warm, not hot, water for 15–20 minutes daily. This increases blood flow to the prostate and can help reduce inflammation. Cold exposure. Brief cold showers or ice baths can reduce inflammation and boost testosterone production. Start with 30 seconds of cold water at the end of your regular shower. Several traditional herbs have shown promise for prostate health. Stinging nettle root. Often combined with saw palmetto, nettle root can help reduce prostate inflammation and improve urinary flow. Pumpkin seed oil. Rich in zinc and healthy fats, pumpkin seed oil has been used traditionally for prostate health in many cultures. Green tea extract. Concentrated green tea polyphenols provide more anti-inflammatory compounds than drinking tea alone. Small changes in daily habits can have profound effects. Bathroom habits. Don't delay urination when you feel the urge. Take your time to fully empty your bladder. Double voiding, urinating, waiting a moment, then trying again, can help ensure complete emptying. Clothing choices. Avoid tight clothing that compresses the pelvic region. Choose breathable fabrics that don't trap heat and moisture. Sexual health. Regular sexual activity helps maintain prostate health by promoting circulation and preventing stagnation of prostatic fluid. Reducing your toxic load supports prostate healing. Water filtration. Use a quality water filter to remove chlorine, fluoride, and other chemicals that can irritate the urinary tract. Organic foods. Choose organic produce when possible to minimize pesticide exposure, particularly for the dirty dozen fruits and vegetables. Natural personal care. Switch to natural, chemical-free soaps, shampoos, and other personal care products to reduce exposure to endocrine disruptors. Air purification. Use HEPA air filters in your home to reduce exposure to airborne toxins and allergens. To ensure your natural approach is working, it's important to track your progress. Keep a daily log of frequency of urination during day and night, urgency episodes, difficulty starting or stopping urination, strength of urinary stream, feeling of incomplete bladder emptying. Work with your healthcare provider to monitor. PSA levels should be checked annually after age 50. Prostate size through digital rectal exam, urinary flow rate tests, post-void residual urine measurements. Track your healthy habits. Daily movement and exercise, sleep quality and duration, stress levels. Dietary adherence, supplement compliance. While natural approaches are highly effective for many men, certain symptoms require immediate medical attention. Red flag symptoms. Complete inability to urinate, blood in urine or semen, severe pelvic or back pain, fever with urinary symptoms, rapid worsening of symptoms, monitoring situations. PSA levels rising rapidly, significant changes in urinary patterns, new onset of erectile dysfunction, persistent pelvic discomfort. As a doctor, I believe you should understand all your options. Conventional treatments for enlarged prostate include medications. Alpha blockers relax prostate muscles, while 5-alpha reductase inhibitors shrink the prostate. Both have side effects including decreased libido, erectile dysfunction, and dizziness. Surgical procedures. Various procedures can remove or reduce prostate tissue. While effective for severe cases, they carry risks of bleeding, infection, and permanent sexual dysfunction. Minimally invasive treatments. Newer options like steam therapy, water vapor treatment, and laser procedures offer middle ground options with fewer side effects than traditional surgery. The key is that natural approaches should be your first line of defense. Many men can avoid medications and procedures entirely by implementing comprehensive lifestyle changes early enough. Let me share some real examples of how these principles work in practice. Robert, age 67, came to me with severe nighttime urination, 5–7 times per night, and weak stream. His PSA was elevated at 6.2. After implementing a movement protocol, anti-inflammatory diet, and stress management techniques, his nighttime urination decreased to 1-2 times per night within 3 months. His PSA dropped to 3.8 after 6 months. James, age 72. A retired executive who spent years sitting at a desk, then sitting in retirement. He had severe urgency and frequency. By adding hourly movement breaks, pelvic floor exercises, and proper hydration timing, his symptoms improved dramatically. He went from urinating every hour to every 3-4 hours during the day. Michael, age 59. Worried about his family history of prostate cancer, he wanted to be proactive. By implementing the complete protocol before significant symptoms developed, he's maintained excellent prostate health for over 5 years with stable, low PSA levels. Taking care of your prostate isn't just about health, it's about economics. The average cost of prostate treatments in the United States. Annual medications, $1,200, $3,600 minimally invasive procedures, $15,000, $25,000 traditional surgery, $25,000, $50,000 ongoing complications and follow-up care, $5,000, $15,000 annually. Compare this to the cost of prevention. Quality supplements, $600, $1,200 annually. Organic food premium, $1,000, $2,000 annually. Gym membership or exercise equipment, $500, $1,500 annually. The prevention approach costs a fraction of treatment while providing superior quality of life outcomes. Many men struggle to implement these changes. Here are the most common obstacles and solutions. I'm too old to change. Age is an advantage, not a disadvantage. Older bodies respond quickly to positive changes because they're more sensitive to health improvements. Many of my oldest patients see the fastest results. I don't have time. The strategies I've outlined require less time than dealing with prostate symptoms. Micro movements throughout the day, simple dietary swaps, and basic supplements take minimal time but provide maximum benefit. It's too expensive. Prevention is always less expensive than treatment. Start with free changes like movement and stress reduction, then gradually add supplements and organic foods as your budget allows. I don't want to give up my favorite foods. You don't have to give up everything you enjoy. The 80-20 rule applies. If you're eating well 80% of the time, the occasional indulgence won't derail your progress. I'm not sure it will work. The science is clear, and the risk is minimal. Unlike pharmaceutical interventions, natural approaches have virtually no downside and multiple additional health benefits. Here's how to implement everything I've shared. Week 1. Foundation building. Start hourly movement breaks during waking hours. Begin basic pelvic floor exercises. Implement strategic hydration timings. Start a symptom tracking journal. Week 2. Dietary changes. Add 1 anti-inflammatory food daily. Reduce processed food consumption by 50%. Eliminate or reduce caffeine after 2 p.m. Increase vegetable intake to 5-7 servings daily. Week 3. Stress and sleep. Implement a 10-minute daily stress reduction practice. Establish consistent sleep and wake times. Create a technology-free bedroom environment. Practice deep breathing exercises twice daily. Week 4. Advanced strategies. Add appropriate supplements based on your specific needs. Implement heat, cold therapy protocols. Begin environmental toxin reduction schedule. Follow up with healthcare provider. Ongoing maintenance. Monthly progress reviews. Quarterly health assessments. Annual comprehensive prostate screening. Continuous education and protocol refinement. Prostate health is just one aspect of successful aging, but it's a crucial one that affects every area of your life. When your prostate is healthy, you sleep better through the night, feel more confident in social situations, maintain better relationships, have more energy for activities you enjoy, worry less about your health, save money on medical expenses, maintain independence longer. The strategies I've outlined don't just improve prostate health, they enhance overall vitality, cognitive function, cardiovascular health, and longevity. If you've made it this far, you're already ahead of 90% of men your age who ignore their prostate health until it's too late. The information I've shared represents decades of clinical experience and thousands of research studies distilled into actionable strategies. The most important thing to remember is this: prostate enlargement is not inevitable. It's largely preventable and often reversible through comprehensive lifestyle changes. The earlier you start, the better your results will be, but it's never too late to begin. Your prostate health is in your hands. Every choice you make, whether to stand up and move, what foods to put on your plate, how you manage stress, when you go to bed, is either supporting or undermining your prostate health. Don't wait for symptoms to worsen. Don't assume that frequent urination, weak stream, or nighttime bathroom trips are just part of getting older. They're not. They're signs that your prostate needs attention, and that attention can come from you through the natural approaches I've outlined. Start today. Pick one habit from this presentation and implement it immediately. Your future self will thank you for taking action now rather than waiting until the problem becomes severe enough to require medical intervention. Remember, your prostate won't heal overnight, but with consistency and patience, you can achieve remarkable improvements in your symptoms and overall quality of life. The science supports it, my clinical experience confirms it, and thousands of men have proven it's possible. Take control of your prostate health today. Your quality of life depends on it.